Make arrangement to the posterior teeth. So the posterior teeth involves important criteria to be established as in anterior teeth. What's the benefit of this criteria to establish the proper occlusal plan? Unfortunately, the arrangement of teeth regarding to the posterior and anterior, we cannot put it within the one level because it will be had a correlation with the mandible movement, because I want to establish the balance occlusion. Okay, so we need to make a curve. When we say this cusp, it should be touched, and this cusp and other one, it should be not touch the table. That means we will do the curve to compensate the mandible movement, to compensate the lateral movement, to compensate forward movement, protrusive, all these movement. It will be a proper accomplished within these criteria. So after accomplish the anterior teeth, we begin to put it the first premolar. What's the main criteria of the first premolar? As we said, we need to make it parallel to the vertical axis. Okay. Regarding to the aesthetic, all teeth you can make it tilted toward distal, but with the first practice, focus about the main criteria. You can make that with advanced stage to put it aesthetics. In the aesthetic zone, it should be distally tilted, as mentioned in the endoscopy. So, my objective now to put it the premolar to have a proper relationship within the table that represents the occlusal plan. After that, when I remove my table, the posterior it should be make occlusion according to the upper. So the upper, we have already had the criteria. We had a curve. We will make a curve from the canine to the premolars. Regarding to the lower, from the cusp of anterior teeth to reach to the retromolar bud. It will be passed within the first edge of the retromolar bud. So this curve, it will be very naturally performed when the patient tend to make a movement to his mandible. Regarding to the premolar, I need to put it within the parallel to the vertical axis. You can maintain the contact area within the canine. So can you make a check to the table? Now we need to make a contact within the lingual cusp. Some reference said within the buccal cusp. Some reference say with the buccal cusp. Which one is for you?
For me, the arch one, the buccal one.
The buccal one should be touch the table. So if I put it within the buccal, how can I establish the curve of Wilson?
Curve of Wilson, because the intercuspation of the premolars of the upper and lower of the upper.
The premolar should be included with the two lower premolars.
Yes.
The two lower premolars have a short lingual cusp. And I want to make contact within the lingual only to make a proper position of the upper cusp included within the lower. So make touch within the lingual one. Okay? This is the main one. It should be many criteria should be established to produce the curve of Wilson, because the lateral movement of the mandible can be performed within this curve. We have a horizontal curve, we have another one, yes, curve of speed that will be compensate curve in the complete denture and curve of Wilson. So just make a contact within the lingual and don't make a severe space within the buccal one. Be sure the long axis should be parallel to the vertical axis. If you want to make an inclination to the distal, my recommendation, don't make it now. Wait for lower teeth to have a good intercuspation, because some artificial teeth had several anatomical shapes. So with original one, we need to make, I told it to make, eventually to make a complete intercuspation within the lower. Okay? And my objective now to preserve the occlusal plan. Okay? Because this premolars, it will be make impact to the other one. The other one, it will be make impact to the molar. So until to reach to the 7, my objective now within the occlusional table, put the teeth within the occlusal plan. There is no one plan for all teeth. This unfortunately is not exist here because we have a human being. Okay? So I will start with the second premolar. Regarding to the contact within the canine, my recommendation for the complete, it's you can make that, you can do it. Don't make a severe contact within the contact area. Leave a teeny space, okay, to have another choice if you want to make deviation of migration of this premolar to establish a final occlusion. So this contact, don't make it severe. As you are a beginner for practice, don't make this contact within the canine now. Okay? Make a thin space. Okay? Don't make a severe contact as a natural. That's right. But leave it, because we have, after the canine relationship, we had posterior teeth. I mean, make the posterior teeth individually. Don't connect it with the anterior teeth. The anterior teeth, it should be performed individually. When you start within the posterior teeth, you already had a space to make a move, horizontal movement for the premolar, okay? To avoid the troubles with the first practice, okay? So academically, if we had class 1, class 2, class 2, class 3, you can make a spacing to compensate the variation in the space that will be obtain additional space to compensate your objective for a normal occlusion. So consequently, we can start within the second premolar now. I mean, there is no severe space here, okay? Yes. Now I can start within the second premolar. What's the criteria of the second premolar?
Same thing.
No, what?
Same thing. The inguinal
No.
should touch.
The long axis should be parallel to the vertical axis, that's right. On the other, regarding to the cusps, both cusps, it should be touch the table. Both cusps, it should be touch the table, okay?
So the intercuspation will be produced by the lower.
What?
The intercuspation.
Yes.
For the functional cusps.
Yes?
Will be like a gate, or we can let it be like lower and lower.
The lower, it should be arranged according to the upper, with one condition. The upper, it should be arranged within the table. So the two cusps, it should represent what? Why I connect two cusps within the table. For the upper, I want to make that curve toward the maxillary tuberosity. Okay? This is our curve in the upper. For the lower, This is the anterior teeth. I will make another curve here. So you can see the second premolar. Sorry, I will put it here. The second premolar, it will be represent the horizontal one without any curve. When I put it within the two cusps within that table, I mean my objective now, this curve, it will be meeting in this area. There is no, we have a curve here, we have a curve here, because we will start within the curve. We follow the other one. The second premolar represents the neutral one in the plan. There is no curve here. Okay? After that, when I put it my 6 here, and my 7 should be put it here, so the 6 of the lower, it should be follow the upper. The 7 one, it should be follow the upper one. The upper, it should be follow the 2 premolars of the lowers, 4 and 5. Okay? So this is the neutral one in this curve. Why I will make it 2 cusps, it should be touch the table.
And the first premolar, the lingual cusp shouldn't touch the table?
I will repeat it. This is 2 curve. Okay? Okay? The first premolars of the upper, this is the anterior tooth, okay? The first premolar of the upper, the contact area should be only at the lingual aspect. Because this is the first of the curve, okay? The second one, both cusps should be touch the table. Because the neutral one, there is no curve here. It seems slightly concave. It seems straight line in that curve. Sorry. The sixth one, the molar, we start with the severe curve. We will start toward maxillary tuberosity, okay? Against to the retromolar bud. If I follow this line, I will touch the retromolar bud within the upper. This is impossible. So the functional cusp only touch the table because it's the biggest one, okay, and longest one. Other cusps should be arranged toward what? Toward the palate. Don't touch any table. Within that severe tilted. The 7 one, there is no any cusp touch the table. There is no any cusp will touch the table. Yes, because I will prepare the curve for the lower. When I remove my table here, okay, when I remove my table here, just I will put it the lowers according to the upper. So the curve, it will be established within this criteria. What's the benefit of this criteria? Because our mandible, before the transitional movement, within the condyle, tends to what? Tends to move in that plan. Within the curve. Okay, this is the movement of the mandible regarding to the protrusive and protrusive. Protrusive and protrusive. What I mean, the mandible normally follow this line, follow this movement. Regarding to the horizontal movement, this is the protrusive and retrusive of the mandible, okay, within the curve. Within the lateral movement, should be moved within this plan. If I had a severe lateral movement, that means I will start with a bennett movement, okay? This is the reasons that will be mandatory to follow the criteria to establish the what? The principles of the balance occlusion. We will prepare it for the balance occlusion, okay? Because we have a many stages to establish all criteria of the balance occlusion. But this is the main one, okay? So make it with the understand the both of cusp, it should touch the table now, because the neutral one, there is no curve here. Not curve, because the curve it will be shallow here, okay? Regarding to the other criteria for the lines the teeth should be upon the crest of the ridge. We mentioned that, but in our practice now, we need to make a proper arrangement that serves the occlusal plan. So you can see my objective now, both of cusp should touch the table. Both of cusp. You can make evaluation from the lingual, from the palatal, to be sure the both of cusp should follow the table. So you can now make evaluation to the contact area, make evaluation to the proper position. The sulcus should be within one line. Be sure the teeth upon the crest of the ridge. Okay. So this is what I need now. Make a sealing, but don't cover the buccal aspect. To be sure the long axis of the teeth should be clearly identified to make evaluation if we have a tilting one, or make evaluation to the long axis, but pay attention to these criteria. Why? Because for your practice, regardless of the scientific principles, for your practice, if we follow these criteria, the lower teeth will be easily make intercuspation. If you don't follow these criteria, there is no way to make intercuspation within the lower. Okay? So this criteria in our practical will assist the intercuspation. What's the criteria of the upper six? The first molar. What's the criteria of the first molar? This is the cornerstone of the posterior teeth. If you put the molar within the normal, if you put the molar with the correct criteria, the normal relationship, the class 1 relationship, it will be established easily within two curves. Because I will make the compensate curve, I will make as well as the curve of Wilson, because I will make a two tilting here, tilting toward the maxillary tuberosity and tilting to the buccal. So we have a severe tilted here in the molar. And regarding to the contact, we need only to make contact within the functional cusp. You can see now, we had, this is a diagram, this is not actual, but we imagine what's the criteria of the molar. We will make it now. This is the functional cusp. Only the functional cusp, it will touch the table. Okay? So that means we have two curves now. The curve against to the lower, toward the maxillary tuberosity, and the other one toward the buccal. We will establish two curves here. This is the mandatory one, because the class 1 relationship cannot be performed without these criteria. It's very easy to put it the molar, lower molar within the upper, if we establish these criteria. Very easy. Okay, within the normal occlusion. Okay? Because we have a central fossa in the lower molar, it should be easily included within the upper cusp. Okay? So pay attention to the molar. For the anterior teeth, the canine. It is the cornerstone. For the posterior teeth, I need to make the molar. Yalla, please pay attention. We have 2 teeth only. So, regarding to the upper first molar, we pay attention to the upper first molar because the upper first molar, it's very essential to accomplish the normal occlusion within 2 curves. So, make a sufficient room for the molar. Be sure the wax should be clean. There is no contamination within the wax. It will be assessed to preserve good occlusion, good adhesion to the teeth. So when put it to your upper 6, tilt your fingers, 2 fingers. Okay, this is my plan. Okay, now tilted your 2 fingers toward what? Toward the occlusal plan. Because I need only this cusp to be occluded, the functional one. The functional cusp should be occluded only. Yes? The functional cusp. Okay? Yes, the mesolingual one, the biggest one. Okay? So this cusp only should be touch the table. So we need 3 spaces here. Okay, but take it with the understand. This does not mean many criteria. There is no many criteria now. Just make it with understand. We leave 3 cusps without contact. 1, 2, 3. This one should be within the little space. This one more than the first one. This one should be what? More than the others. Okay? So I will distribute the spaces to these cusps. This will touch the cusp. It will be not touch the cusp, but teeny space. This one, it will be more. The axis of space, it will be located here.
More space
Yes.
near to the table.
Yes, that's very normal to say that. If you want, don't follow this criteria. Make it with a tilting. Make it with a tilting. Yes, when make it with a tilting, the space it will be performed with these gaps. The gaps within the cusp, okay, should not be equal. Because if there is equal in the gaps within these cusps, 3 cusps, there is no tilting. My objective to make a tilting. Okay? Now I try to perform this criteria. So remove the excess of wax from here. Make a sufficient room for the molar, for your fingers. Make a tilting as yes to the palate. No, to the lower. Make a tilting here. So the molar, it will be easily inserted within the wax socket, within the tilting, and there is no any blame about the ugly shape within the plan, I mean, because this is the correct plan for the molar. Okay?
What do you mean by ugly shape?
Ugly shape because the molar, in your mind, it should put it within the one level, within the horizontal level. No way. This is not normal. This is the correct one. It should be put it within the tilted. Because the molar, it will be make a key within the lower. Okay? When I make evaluation from the buccal side, this cusp, this will be what? Raised comparison with the other one, with the distal one. If I make a comparison within this aspect, only this cusp raised, because it will be make a contact within the table. This cusp should not contact with any contact within the table. R3 cusp. The severe space, it will be located what here? Okay? Yes. The severe one, it will be located here because this is a severe tilting toward the palate. So make evaluation according to the table. This is the benefit of the table. This is the benefit of the table. I will make these criteria within the table. So I had a severe space here. Now I can make adjustment to the molar. You can see this is the severe space. The first one should be located, the first contact should be located within the molar. You can see I will rise this cusp toward the table. I will rise this cusp toward the table. Make a check. You can see only this cusp had touch within the table. Only this cusp should touch the table. Make evaluation from the posterior aspect. To be sure, the functional cusp only touch the table and the other tilting should be performed now. The contact within the teeth, within this tilting, it will be normally performed.
Contact of what?
Yes, this is criteria of the natural teeth.
Of the premolars.
Yes, within the occlusion third. Should be located in the occlusion third. When make a tilting, okay, against to the mesial side, the contact will be easily performed. This criteria, it is the normal one, the normal package for the natural teeth. Okay? So you can see where's the contact area on the posterior. It should be the other occlusion third. That's right?
We leave the tiny space between the first and canine. We don't leave any space between other.
No. This is my objective. Don't leave any space. But for the beginner, for the first practice, there's a permission to make that. Yes, to what? I will connect the posterior and anterior in the advanced feature. But now I need to establish the occlusion. Okay? So as you as students, as you a beginner, with this practice, take it easy. Okay? There is no mandatory rules to perform all criteria. Now we will start to make the practice. Okay? This is what I mean. This is the first one. The other one, academically, if you had a small arch of the biggest arch regarding to the lower, you can make the spacing to compensate this within the actual patient. May we have the lower upper arch within the lower one. I need to compensate the spacing because my objective with any issue, with any problems, to perform the normal occlusion. Okay? To perform the function. Okay? After that, I will perform the aesthetic. Because the main objective of the complete denture or any full arch, this is the function. If you need to make aesthetic, make it with the implant for anterior tooth, that's only. The main one to preserve the function, main one to preserve the normal position of the condyle. So this is what I mean now. There is a contact just in the palatal cusp, that means the functional cusp. Okay. Yes.
إذا ال6 ما راح يكون كونتاكت ويا تيبل بس كاسب واحد.
Yeah.
زين ليش إحنا لما سوينا البايت ريم إنه سويناه؟
This is a good question. Good question. عادي لا تقطعي. The good question. The students say if we had only contact within the table for the regarding the functional cusp, what's the benefit of the straight line, the straight plan of the bite? The bite will represent the occlusal plan. What's the benefit for this plan? Because when I make it within the table, I will follow this criteria. Only one cusp. If you don't have a plan, if you don't have this table, okay, you can make it within the bite. Only the functional cusp should be exceed the plan of the bite. Okay, all cusps within the bite, only this cusp should be raised, prominent from the bite. You can't do it without the table, but the table will assist your practice. Okay, the table is a tool. Okay, just a tool to perform these criteria, these principles. Okay. What's the criteria of the 7?
Don't touch the table.
Yes, that's right. 4 cusps should not touch the tables. The 7, the criteria of the 7, all cusps should not touch the tables. That's right. But what the mandatory one?
Should not comment.
That's right. What I mean now, regarding to the upper 7, the second molar, all cusps should not touch the table because I am reached to this plan, to this curve. Okay, this is a sky slope. There's no, I cannot make any teeth here within the lower. This is a retromolar part. Okay, this is the first one. This is the second one. So the 7 located here, the upper will follow the 7. So when I reach to this curve, that means the 7 should be raised toward the billet. Don't touch the table. No, any cusp touch the table because you have a severe curve here. Okay? Regarding to the lower, in the next lab, I will put it according to the upper 7 and the upper 6. That's right. So what I mean now, what about the compensate curve? What about the curve of Wilson? When all cusps should not touch the table, that means I reach to the severe curve here. Okay, the severe curvature here. But the mandatory one, you should preserve, you should maintain the same tilting of the 6. The same tilting of the 6. It is very mandatory one. Because if you had a mistake with the 6, for regarding to the tilting, there is no way for the 7. Because the lower teeth should follow the normal occlusion. The normal occlusion should not accomplish without this criteria. So don't make any touching to the cusps. But regarding to the plan, the tilting plan, this is a mandatory one. If you don't make it with the 6, that's a mistake. But within the 7, this is a horrible mistake. Okay? So the 7 should follow the tilting, and I start to look my curve within the crest of the ridge, because I will make this curve regarding to the curve. This is my canine. This is my premolars. So there is no straight line in the posterior teeth. Okay, I had a curve here. The upper 6 should be located here. The lower, the upper 7, the upper molar should be start to make a final curve here. Okay? Yes, a horizontal one, I mean. Within the tilting, so the lower molars easily contact with the normal occlusion, the grooves within the cusp. Okay? Now, when I had this task, prepare sufficient room, a proper wax to accomplish this task. Please don't make your work, make it easy. I mean, be sure the wax should be had a good properties. Okay? Be sure there is no any contamination here. Be sure there is no severe molting and make a cold severe molting within the water. Don't use the water. Okay? Because you will make a shrinkage. Okay? Just make a preheating and make another one. Rise the heating. When make a heating, make to the whole of the wax. Okay, don't make a heating here, and the other one should be remain a cold. Make it all, okay? Because after cold of the wax, we have a change in the wax according to the shrinkage one, okay? So I restore the information of the upper 7, the mandatory one. I will preserve the one tilting, okay? This is what I mean. This is the upper 7, okay? So the same tilting should be performed in the upper 7. There is no any touching in the cusps. Same procedure. Put it with your fingers and start to make a tilting now, okay, toward the buccal, but without any contact of these cusps. Because what? Because the lower 7, it's already raised. What's the benefit of the no touching in the cusp? When I don't make a touching, because this is the curve is mandatory. This is the table. This is my table. Okay? When I put it my upper 7 here, without any contact, I permit lower 7 should be put it within the normal occlusion, because this is a retromolar bud. My curve should be follow this retromolar bud. The cornerstone of this curve, the retromolar bud, the anterior border of the retromolar bud. So this is my reference. This is my benchmark. It is unacceptable. No way to put it the upper 7 within this level, because this level it should be prepared for the what? For the lower 7. So when I put it the lower 7 within the retromolar bud, just know this with the occlusal plan. I mean, okay? It should be established in the cast. The upper 7 is mandatory. Put it away from the table, okay? To permit the normal occlusion. This is the individual information. Other one, these criteria regarding to the inclination, I need to make it regarding to what? To the mandible movement. Because I have a curvature plan within the movement. It is not severely obvious within the eye, but it's the normal movement of the mandible. It should be follow the curve, okay? Follow the curve. So check the space regarding to the upper 7. It is a severe space, okay? Okay? Touch with what? Touch with the lower. Touch with the lower. Yes, if you make an impression with the normal occlusion and put it the all teeth, okay, upon the table, horizontal plan, and make a check. This seems there is no horizontal plan. But within the complete denture, it's mandatory to make it, because I want to accomplish my objective in complete denture, to perform the balance occlusion regarding to the working side and non-working side. Okay? So just keep the tilting without any contact. This is my objective. So the lower 7, it should be below, okay, to the upper one. So this is my mistake. You can see the crest of the ridge now. The teeth, it seems out of the crest of the ridge. You can make another tilting, because within the demonstration, I can not focus upon the out criteria. It's easy to make evaluation, and sometimes I will make a mistake to say to the students, there is no, I cannot accomplish all criteria. You can make a mistake. Make adjustment, okay? This is upon the crest of the ridge now, within the same tilting. Or only this cusp There is no cusp touch the table, but I will preserve the tilting now. The space of the table, it should be what? 1 millimeters? Okay, 1 millimeters? In your theory lecture, 1 millimeter or 2 millimeters regarding to the space?
We don't study that.
There's no information about that?
No.
The actual reference is not the to measure this space. The actual one, I will put it my lower, depending to the retromolar part. Regarding to what? Regarding to this plan. This is my plan. I will check the lower 7. It should be located here. Okay. So I will check my upper tilting regarding to the retromolar part. Okay. This is what I mean. Any question? So please, you can make adjustment. This is not final work. Okay. You can make adjustment when you follow the lower. Make adjustment, but regarding to the criteria. This is the demonstration. This is a demonstration for your practice. Okay. So the procedure is not completed now because I have to make intercuspation. But our objective in this lab to mention we have the criteria in the upper and the